Butler, and I'm a student nurse, and I'm going to be demonstrating how to administer a flu MMR, a varicella, and Tylenol by mouth. Okay, so the first thing I'm going to do is I'm going to check my doctor's orders, and I'm looking for the right patient, the right medication, the right doses, the right time, the right route. I'm gonna be doing the right documentation. It has the right to refusal, the right reason, and the right response. Okay, so on here, when you give an injection on the child, you're going to do the vasculators, and you're going to do it right here in the side. This is where I would inject my injection. Okay. So let's go ahead and get straight. Okay, so for a by mouth, Tylenol, I'm looking on here for checking my 9 rights, and I'm going to wash my hands, put on my gloves, and I'm going to draw up my medication. And for a child that's around 18, 19 pounds, you're going to give 3.75 mLs. So I have my 3.75 mLs of Tylenol in this syringe, and I have it drawn up. So I'm going to knock on the door, come in, introduce myself, ask the mother to make sure to state that this is the child and this is Miss Janae. I have some medicine for you. So what I do is I can, and either the mother can hold the child, and I would have here and have the child. I'm going to put it in the side of the child's mouth. Open up, son. Put it in the side of the mouth, and I'm going to give a little bit. Go ahead and have them swallow. Go ahead and swallow. Push a little bit more and have them swallow. And I'm ensuring that they do not spill some out. Okay, and now finish. Back inside the mouth right there. Okay, so I take off my gloves, and then I go ahead and wash my hands, and then go ahead and document. Okay, so to administer the flu vaccine, go ahead and do the same thing, check my 9 rights, and wash my hands and apply my gloves back on. For the flu, we're doing a IM vaccine, and I'm going to be using a 23 gauge 1-inch needle, and this is my flu valve. So I go ahead, make sure my needle's on there, and I'm going to wipe off the top. Now I'm going to draw up my air. 0.5. Put it in here. Push it down. Pull out 0.5. Okay. Make sure I don't have no bubbles in this. Recap my needle with the 1-hand scoop. And now I'm ready to go inside the room. Okay. So now that I'm going inside the room, do my 9 rights or whatever. And as I demonstrated, where I would put it here on the vasculators right there. Okay. Go ahead and clean up that area. And go away. And we're doing 90 degrees angle, inject, hold, secure, push down, safety lock. Okay. All right, safety lock. I'm still do this. Okay. All right, so that's that. Now we're doing our sub Q. So I'm going to do the same thing again, wash my hands, introduce myself, check in. I'm going to take my alcohol, wipe it off. And I'm using for a sub Q, I'm using a 25 gauge 5/8 inch needle. And taking it off, pull up my air, 0.5. Search. Making sure that I don't have any air bubbles. Recap. Super. Okay, this one we're going to do a 45-degree angle. So and this is 45 degrees like this. Insert all the way down to the hub, secure, press down. Safety on. And then I would also do the same thing sub Q for our Vasella. And then I'm also going to use a 25 gauge 5 inch, and that is it.